Attention Deficit Hyperactivity Disorder. It's affecting more and more young people, but adults are also dealing with this challenging diagnosis. ADHD is a mental health disorder which typically results in above normal levels of hyperactive and impulsive behaviour. It also affects focusing on a single task and sitting still for extended periods of time. Other symptoms include forgetfulness, being easily distracted, and interrupting in conversations, which unfortunately is often perceived as rudeness. There are, as is common with mental illness, several different types of ADHD, so we're going to take a quick look at those now. Predominantly inattentive. This causes extreme difficulty in focusing, following instructions and completing tasks. Most prevalent among girls with ADHD, it can be tough to diagnose as sufferers tend to be more introverted than would typically be expected of an ADHD sufferer. Secondly, predominantly hyperactive impulsive type. Now, as the description suggests, people who fall into this category mainly display hyperactive and impulsive behaviour. Impatience and fidgeting are the main indicators of this type of ADHD. Focus is less affected than other types of ADHD diagnosis, but people who fall into this category of ADHD may still be challenged when it comes to focusing on a single task. Combined hyperactive impulse and inattentive type. This is the most common type of ADHD diagnosis, displaying both symptoms of inattentive and hyperactive. So these ADHD types tend toward impulsiveness, manic energy and activity, and inability to concentrate. These types can change over time, so it's important to stay in touch with the GP, keep on top of the situation, and make sure you're getting the right treatment because you've got the right diagnosis. Up to 10% of 5 to 17-year-olds will receive an ADHD diagnosis. So it's one of the more common neurodevelopmental disorders in childhood. Misbehaviour at school is most associated with children with these diagnoses, making it harder for them to focus, concentrate, and ultimately succeed academically. So it is important that you get this diagnosed and treated. Interestingly, boys are twice as likely to receive an ADHD diagnosis than girls, and this may be because, as we mentioned earlier, the fact that girls tend to display the more subdued symptoms such as hypertalkativeness rather than hyperactivity, and tend more towards daydreaming, whereas boys tend to display the more hyperactive symptoms which are most commonly associated with a classic ADHD diagnosis. Now, that being said, some symptoms can be analogous with typical childhood behaviour, misbehaving, acting out, so a firm diagnosis can be hard, but stick to it, talk to your GP, and make sure that you and the situation are being taken seriously. Though genetics play a role, ADHD is believed to have primarily neurological origins. A reduction in dopamine in the brain, a chemical which triggers movement and emotional response by helping the brain signal move from one nerve to another. There seems to be structural differences in the brain also. Researchers found that people who have an ADHD diagnosis have less grey matter in their brains than people who don't. This has an impact on decision making, muscle control, self-control, and speech. Treatment usually combines medication and or behavioural therapies such as talk therapy can be useful, allowing discussion of how life is day to day with ADHD, but also setting in place strategies and tactics to deal with the difficulties presented. Medication is often beneficial, helping regulate brain chemicals, so actions and impulses are better controlled. The two most common types of medication used to treat ADHD are stimulants and non-stimulants. Both help increase levels of norepinephrine, a chemical in the brain, a naturally occurring chemical which acts dually as a stress hormone and neurotransmitter, a substance which sends signals between nerve cells. Now, stimulants out of the two are more likely to manifest side effects, so if you're suffering from those, again, consult with a GP and talk about maybe getting switched over to non-stimulants or discussing alternatives. Certain natural remedies can also help improve the quality of life for people with ADHD. A healthy lifestyle can certainly make a difference. A balanced, nutritious diet, about an hour's worth of moderate physical activity per day, and 8 hours of sleep every night are all recommended. Being active outdoors or maybe activities such as yoga can also help settle hectic minds and go some way to relieving ADHD symptoms. As we've said, diet is important. Eliminating potentially unhealthy food additives is a great way to go. And again, it'll help reduce symptoms. Another option is mindfulness meditation. In both young people and adults, it will have positive outcomes for thought processes and attentiveness. Structure and consistency are also important. A solid routine will also help increased focus. And finally, talk to your doctor if you, your child, someone you know is exhibiting these symptoms, because without treatment, the situation is just going to continue to deteriorate. It's going to be more challenging for them. It's going to be more challenging for you. So it's important to get help.